Thank you everyone for joining tonight's patient webinar presented by New Jersey Plastic Surgery. Tonight's webinar is all about the breakthroughs in facial rejuvenation. It's called Face to Face, the rapid recovery alternative to a facelift. Tonight's webinar is presented by New Jersey Plastic Surgery. For those of you in the tri-state area or in near the practice, you'll know that Dr. Barry DiBernardo is one of the most well-known, influential leaders in the aesthetic industry, and New Jersey Plastic Surgery is the go-to facility in the tri-state area. You can see from this slide how they are just featured on every single media outlet you can think of. And there will be some more information after the webinar about an exclusive special offer that only attendees of tonight's event will be able to take advantage of, and how they can contact New Jersey Plastic Surgery about that. And before I bring on Dr. DiBernardo, I just wanted to do a very, very simple introduction. He is a director and the owner of New Jersey Plastic Surgery, and he also has a clinical research component to the practice that he spearheads. This is really what has led him to become such a innovator and has really earned him the reputation of always being on the cutting edge of the latest breakthroughs in aesthetic treatments and procedures and things like that. Reason being why he's doing this presentation tonight for you, the patients. There's a million credentials I could go on and on, but I think it's probably easiest just to bring out Dr. DiBernardo himself and let him just go ahead and get going, so that everyone tonight can really see this exciting option that he's going to be presenting. So Dr. DiBernardo, if you want to go ahead and join us, then you can say hello to everyone from your very, very modern spaceship.
Yeah, we're on the way to Mars now to join the rover, because there's a lot of high tech going on Mars. So we may have our next innovations up there. So thank you for that introduction, Ronnie, and thank you everybody for joining us tonight. We've done these kind of programs for the last over 25 years, and we would get everybody together in a hotel or something like this. But as technologies progressed, we're in the comfort of our homes or in a spaceship or wherever else you want to be, and you can sit back, watch, ask questions easily. So I think the format works really well for what we're doing, and lots and lots of people are able to watch this. So anyway, we picked some facial innovations this evening that I think the trend is to do more and more, have less downtime, do it with local anesthesia in the office, and get results that are probably as good, if not surpassing, some of the things we can do surgically. So that's what we're going to talk about tonight, particularly the neck. So what are the problems we see in the aesthetic neck? You can have loose skin, you can have too much fat, and really the clincher sometimes is the loose muscle, the turkey neck, the bands. So what we have is one of the biggest innovations we've seen in the last decade, that we can address all these things, including the muscle bands, with no incisions, no sutures, and that's called the MyEllevate procedure. So a lot of the problems with aesthetically with the neck is, in a younger patient such as this, you can have too much fat, and we would do liposuction. But for the younger patient who doesn't have muscle bands, I ask them, I say, you can look a certain way, or you can look even more defined, and MyEllevate adds that to the younger patients. In the patient who's older, we need to do more skin excision, and traditionally this was the facelift. The facelift had to address the loose skin, the fat, the muscle, and it required a big operating room, usually in the hospital, longer recovery, more downtime. The cost of all of that and longer time is more expensive. And it deals with the skin and fat, somewhat with the muscle. But that's what we've done for the last 30 years. And through research we've done at New Jersey Clinical Research Center over the last 10 years was using energy, starting with laser-based energy, then radio frequency energy, and now plasma energy. So all sorts of energy sources to tighten the skin. So that's what we've been doing for years to eliminate incisions. And we've published this in our leading journals, in the Aesthetic Surgery Journal. And that was our work that showed that laser tightening skin versus liposuction alone caused more shrinkage of the skin, 35% more shrinkage at 1 month, 54% more at 3 months. And this was the basis of us being able to tighten skin without surgical intervention. Now, we also looked at the other component, just going back, when you get older, your skin loses the plumpness, which is collagen, and it also loses those little rubber bands in the skin, the elasticity. So as you get older, this is lost. And the big innovation with the study we did was where with energy, with laser, we're able to bring back the elasticity up to 62% at 3 months, and it continues. We found it got even more so at 6 months. So using energy to tighten skin is something we've proven and something we've done. And you can see here, this is a patient who, many years ago, we would say, you must do a facelift. There's really no other choice. But this was laser. This was not surgical. This was not a facelift. So her situation, she doesn't have prominent muscle bands. So doing some fat removal, doing some skin tightening with laser, we were able to make good changes. And she, by the way, I told her, you know what? The laser's not going to do it for you. You need a facelift. She goes, I don't want to do surgery. Just do it anyway. Let's see how we do. And in this instance, she was right. Again, example of going after fat, going after loose skin with a single treatment. And at the same time, if you look, taking that excess eyelid skin off, and you can see now why we're presenting tonight the presentation of eyelids and necks together, because those are the two areas that people look at when they talk to you. First they go to the eyes, then they go to the neck and the jowl area, and that's where they see the aging in your face. So if we can take care of both of those in the office still in 1 hour, that's a great breakthrough. And that's something that I speak about at the plastic surgery meetings. And then the other question is, okay, that's all well and good. You can tighten skin, but does it last? And this is the same patient. We can see her eyelids, we can see her neck. This is 2 years later, so it's still lasting at 2 years. And if we look at the next slide, this was a patient that I had done laser skin tightening with, and nothing else. She did nothing at all for 10 years. And you can still see when she's in her later 40s, it's still holding. And that's a testament that once we change the skin to make more collagen, make more elastin, it is a longer lasting result. But what you can see, which she was starting it's a perfect neckline, but we're starting to see those little bands creep up. So when you move from your 30s with excess fat to 40s and into the 50s, we start to see the loose muscle bands called the platysma muscle. And if we ask someone to bite down or clamp down like this, you can really accentuate the platysma muscle and the anterior bands, which is in front. there are bands in the back, and that width is the width of that whole muscle. And this is what we were unable to treat except with surgery up until this past year. So it's the muscle bands that is the heart of the MyEllevate procedure. Now, let's just back up from what we're talking about and look at what's going on in the media these days. So this is the Wall Street Journal. They're talking about these video conferences, what we're on right now, and everybody is you only see the face, you see the eyes, you see the neck, and they actually started calling this the Zoom neck because patients are self-conscious about how their neck looks and how the hanging of the skin and the muscle looks. So the Wall Street Journal called it the Zoom neck. If you look at websites or electronic media from many physicians across the country, we see all sorts of therapies that we've heard, such as all therapy. And if you look at the photos, these are photos of a before and after where, yes, the skin is tighter, but look at the muscle bands. It is the part that these devices cannot treat. That's Ulthera. In this instance, the injection for fat called Kybella, you can do an injection and melt fat, but if that works and you have less fat, look at the photos that people are putting on their websites, you still see the muscle bands. So it's all of these treatments that are out there. They can address fat, they can address skin, but they cannot address the loose muscle. They're limited by these bands. And if you're looking at someone's neck to be judgmental of how good the procedure did, it really doesn't look finished unless we can get the bands. So that's what MyEllevate is, and that's what we're going to be talking about today. And it is a bookend procedure, meaning the beginning of the MyEllevate procedure through little pokes, no big incisions, takes care of the muscle bands in the neck. That's the first step. Then we can address excess fat with liposuction. We can tighten the skin with our energy devices. And then at the end of the procedure, we continue the MyEllevate suspension to accentuate the jawline to give it that crisp look. So that's what the MyEllevate procedure is.
It's such a pleasure to be here today with my colleagues. I'm here with Dr. Barry DiBernardo, Dr. Jason Posner, and Dr. Matt Travato. We're here today to talk about MyEllevate and talk about what types of patients really benefit from the procedure. This is something that I pioneered over the last several years, and we just introduced in early 2020. And it's really exciting to see the results that you all have obtained and other surgeons throughout the country. It's a great procedure for somebody who's just starting to notice some aging in the neck area, or even for older patients who maybe had a prior procedure who don't want to undergo a more invasive procedure. It's a way for them to sort of smooth, shape, and elevate the area underneath the jawline. So today we just want to talk about a few patients and hope that our viewers can see sort of if this is something that would work for them. We're going to talk a little bit about the procedure, what it involves, the recovery time, and everything like that. So as we get started, I think what we'll do is we'll go to our first patient. And this is a young lady who came to see me. She's in her mid-50s, and she was very nervous about having a facelift or neck lift. And these are a lot of our patients today. I'm sure that you all would agree who come in. They don't want to undergo invasive surgery. So this patient underwent a laser that's called Precision Smart Lipo that tightened her skin. We did a little bit of liposuction. You can see she's got a little bit of fat underneath her chin in the before picture. And then the MyEllevate light guided suture suspension. These are 3 years after the procedure. I just wanted to ask you all what you think about these pictures and if you would have recommended anything else for her.
So I'll start with, for those who are viewing this, this is a remarkable result in this category, which is, why are you watching this? This is minimally invasive surgery or minimally invasive procedure. And for those who don't want to go to surgery and have a bigger procedure, this addresses everything about the neck, the loose skin, the excess fat, and those muscle bands. So to see this kind of result in a procedure less than an hour in the office with local anesthesia is just a great advance in 2020.
Yeah, I mean, I would have done it. I look at her before and I go, you need a facelift. So this is remarkable that you can get away without the scars with a minimally invasive approach with rapid recovery. So, you know, let me turn the tables on you for a second with this. Let's say you did just laser liposuction on her and you didn't use the suture, light-guided suture suspension. What do you think the result would have been? I don't think you could have achieved that degree of neck definition without the suture, but I'd like to hear from you.
Sure. What's so important, I think, when we think about our necks is to think about what makes our neck contours. So a lot of people think it's just fat or they think it's just loose skin. But if you look at her neck, we know that she also has some muscle sagging there. So if I had done her, as you were suggesting, just with liposuction and just removing some fat and maybe some energy to tighten her skin, she would have still had the bands that people get in the front of the neck, because that muscle is underneath there and it needs to be supported. And that's where MyEllevate is amazing for these patients. Without opening the neck, we can support that area through a series of little punctures.
And I think more than just support is what Greg was just saying, is that to be able to divide those platysmal bands at multiple sites is something that you can't underestimate in a patient. So between the band division and the supportive sling, it really is the missing link. It's very much a game changer, all percutaneously.
Thank you. And you know what I'd love to do right now? I think it's a good time for us to look at the device, how we do this. And the device we use it's a light-guided suture delivery system. And basically what it is, it's a fiber optic lighted rod with a suture attached to the center with a light source. And what the surgeon does is the surgeon places this light underneath the skin through little punctures, and they can see exactly where it's passing underneath the skin. And that makes sure that it's placed accurately and safely in the exact right place where you need to support the area, like you can see on this patient. But it's a real innovation it's pretty amazing, and there's nothing else like it.
Good. So this is an animation of what the procedure actually is. And we put that little clip because Dr. Greg Miller, who you saw speaking there from Beverly Hills, he developed this procedure based on a procedure or a paper that we wrote in the 1990s, which was the neck suture suspension procedure, and then minimized it to this. So what we're showing here is the path that the light guide goes through, and as you heard in the video, that keeps us at the precise depth and the precise space that we need to be to accurately enhance the neck by placing the MyEllevate suture. And this way we're not too deep, we're not too superficial, it's just right. And that's why these are all little pokes, they're not incisions, and they're so small they don't need to be closed. And that's basically how we do the last part of procedure after we've removed fat or tightened skin.
Yeah, because the MyEllevate procedure does not involve any incisions, the pain is so low after the procedures. Most patients will just take regular Tylenol. We have our patients, take it easy for the first few days and apply ice to the area. Since there are no incisions, we don't have to worry about wound healing or suture removal or anything like that.
But you taught us, we wrapped them one night in a sort of a bigger dressing, and then the next day we put them in a lighter dressing that they wear for a couple of days.
And that dressing allows the swelling to dissipate, the bruising to dissipate. So within a few days, they look very good.
Absolutely. So let's move on to our next patient. And Dr. Travato, you're new to the MyEllevate world.
Right.
Can you tell us a little bit about this patient?
Yeah, this is a 75-year-old gentleman who feels young and great. He's a very active guy, but when he looks in the mirror, just doesn't feel like the way he looks reflects the way he feels. He did not want general anesthesia. He was not interested in having a invasive surgery, neck lift, facelift, etc. And so we used MyEllevate to basically create that internal sling after dividing the platysmal bands. So we took care of that banding. We created that internal ligament basically, and then what I did, which I really enjoy doing on the older patients, is I do use a periauricular or around the ear and retroauricular or behind the ear incision, where I'm able to, after I've tightened that sling, pick up all that redundancy that you would otherwise do in a mini face or neck. The difference is that in these patients, by supporting the neck, there's no tension on any of these incisions. And so for this patient, in about an hour from door to door, this patient achieved this result. He's very, very happy. It looks like he lost about 20 pounds just by cleaning up his neck the way we did.
That's a fantastic result. I wanted to ask you, did you use any energy-based skin tightening technology?
No, just liposuction. So I divided the bands in maybe 5 or 6 places. I'm very aggressive with respect to that tool and the platysmal bands. I've just this week, I divided maybe 8 bands. Because if you knock out the primary band, there's always going to be a secondary one that acts up. So anyhow, we did the bands, we did liposuction after putting about 400 cc's, 300 cc's of tumescent, no energy at all.
That's a great result, and I like your innovation of doing a little bit of a skin tuck behind the ear.
And this is a great example, because without this combo of the two things you did, he would not have done anything.
No, I would previously have to do a suture suspension open technique,
which he didn't want to do.
Which he did not want to do. And this really allows me to divide bands in a way that I wouldn't be able to do with the open technique.
So Jason, you've been doing this since about almost a year. Who are the ideal patients?
I think, to me, this would be an advanced case. That wouldn't be my first case. I think this is ideally for your pre-facelift crowd. Those Botox and filler patients who are in their 30s and 40s and early 50s, who have a little bit of laxity, they have some banding, they may have some prominent submandibular glands, and they're just starting to lose their neck definition. That they all come in with the same complaints. I'm a little loose here and I like my jowls. And you know, from the jowl perspective, the suture tucks in the jowl. So when you pull this in and define that neck, the jowl gets tucked in here. Plus, if there's any fat, you're lipoing it away. So it is a great jowl procedure.
And that's what you mean by bands and glands, the two things that affect the contour of your neck.
Absolutely. And then Barry, I have a question for you. If you had a patient who had energy-based skin tightening and they had banding afterwards, would this be a procedure that would work for them?
Absolutely, and that's a great question for us, because I have 10 years of patients with that, and they may not have had it at the time, but as they've gotten older, I've got skin tightening doing well for years, but the bands are showing up. They don't need anything else, so this is just easy to add this on later, and there's a lot of patients that would qualify for that as well.
I want to give you a rhetorical question.
Yes.
Okay, all you guys, because I get this all the time. So you have a patient, let's say, who's 50, who has a little bit of laxity, and I look at them and I go, you know, chip shot elevate, you're a perfect elevate. And they go, well, I'd rather have a facelift and get it out of the way now. That's what I hear all the time. Well, maybe I should just do this now. And I don't look at it like that. I mean, I think that you should probably push that off, because that facelift may not age as well as the elevate to me. Meaning that secondary facelift that you might need in 5 or 7 years might not be the ideal situation then. Does that make sense?
Yeah, oh, absolutely.
It's a different answer in 2020 than in 2010. That may have been the right answer 10 years ago, but with all the tools we have now, that's probably not the correct
So how
answer.
would you answer that patient who says to you, okay, you know, I'm 50, shouldn't I just get it out of the way now? What was your wording? What's your talk track?
Yeah, so what I do, I mean, I have a lot of patients who come to see me, and I do a lot of facelifts and neck lifts. I love doing them. But when I see them and I don't feel they're ready for it, I talk to them about the new technologies of energy-based skin tightening. And just like you were saying, Jason, you know, I agree with you. I think doing too much too early looks a little fake. And so I think it's good to start out and do things in a stepwise manner. So maybe in a younger patient, maybe in their early 50s, do the MyEllevate procedure combined with energy if you need it. Then you're kind of restoring and renewing their neck, and you're going to hold things there because you have that suture suspension there that's going to support everything. So they're going to age a little more gracefully or a little slowly, and then later on you do skin removal.
But also, you know, it's very intuitive for the patients to understand this procedure, because so many of my patients at 42, 43 years old come in and say, isn't there something you just do this? Isn't there something?
Right.
And now the answer is yes, this is exactly what this does. It just goes right here. And they understand it, and because they can understand it so easily, it makes them more willing to commit to it. And I don't want a 42-year-old really to be committed to that full facelift incision.
And I always say that, I like the iPhone analogy. Okay, this is our iPhone 11 or 12 now. And in 5 years, there may be other adjunct techniques that even tighten better that are adjunctive to this. So you might, in 5 years from now, when you're 55, if I do this to you at age 50, there might just be some little tweaking, tightening that we can do that you might not need a facelift ever.
Well, we don't really need to wait because we have devices now. If we're working beautifully on the neck, we have other devices that can tighten the rest of the face with no downtime, completely non-invasive, and you can combine the two right now
Which we do.
today.
So I just wanted to tell you, summarize who are the ideal patients for this procedure. I've done the procedure on patients as young as early 20s, and those are patients who were born with just that ski slope neck. And I know there are patients out there who have that, who are not overweight, but they just have sort of that obtuse neck. Those are great patients, especially if you have them grimace and you see some of the banding, which most people have, the muscles there. It totally just restores and recreates this beautiful jawline. So that's the younger end. And just like we were talking about earlier, the older patients, maybe a patient like yours, Dr. Travato, who did not want to have a traditional neck lift or facelift, you're going to get a lot of improvement because you're supporting that area. And because we're not separating the skin from the underlying muscles, when you tie up the light-guided suture suspension, everything's lifting as a composite. And that's why you got such nice contours of the neck. And then the patients who are early aging, like I think the majority, the lion's share that I see are patients in their 40s who would not be a good candidate for a neck lift or facelift. It's overkill, but to do something like this is gonna really give them that sculpted jawline.
And as Barry said, 10 years ago, we were saying to those early 40s with early aging, we would say, you need a facelift. And what percentage actually went for that? A high percentage will go for this. Minimally invasive, quick recovery, no visible scarring. I mean, this is a no-brainer for most patients.
This has what the aesthetic patient of today is looking for.
And then Barry, a question for you. You have extensive experience with energy-based skin tightening. Why is this different than energy-based skin tightening? Why is this an adjunct?
Apples and oranges. Energy tightened skin does not address muscle. To get the perfect neck contour result, you need to address all the components. As I said, fat, easy. We did liposuction for years. Next advance was tightening skin with all different types of energy we did research on. The muscle was our roadblock. So this, Matt said, is the missing link. It now ties in the whole repertoire of what we did in full surgery to the minimally invasive procedure, percutaneous.
Okay, we're back. Well, I like to hear, I like you guys to hear how we, the plastic surgeons, discuss a procedure like this back and forth. I think it gives you a sense of how we feel about it. And from that video, we're gonna, Lewis, the patient that you saw who's 75 years old, we're gonna hear him from him shortly live. And also we're going to tell you about Dr. Travato, our associate, and his upcoming webinars as well. So let's look at some of our before and after patients for MyEllevate. So this is a patient, I'm showing this one, she's in her 30s, but she had a little laxity in the skin, wanted more definition. This photo taken is 1 day later. People ask how long does it take to heal from this? You can see two little dots there. Those are the punctures healing. Those go away in days. And you can see she's already seeing her definition and really not a lot of bruising, swelling, etc. This patient's in her late 40s. You can see a prominent muscle band, loose skin, and that was what was showing up. And the photo you're seeing is about 2 weeks later. definitions there. Skin is starting to tighten with the energy that we used. And she's presentable in 2 weeks. All the little dots have healed, and it's going to get better and better as we go. This gives you an idea of what happens over the weeks when we do tightening. This patient's 56 years old. Before we did anything, you could see the loose skin, you could see the bands. At 1 week, the bands were eliminated, the skin was tightening, but as I've been saying, the skin tightens and continues to tighten for months, up to 6 months. But here you can see, even at 3 weeks, just the progress that it makes as it goes through that progression of tightening. Here's someone with more fat. So again, this is 3 weeks after. She's in her 50s and just makes her whole face look a lot slimmer. It will continue to improve, but again, this is just 3 weeks later and pretty much presentable in a few weeks. And here's another one of our patients. Sandra took these photos with her phone, and she's in her 50s. She didn't like the jowling. She didn't like the loose skin and the wrinkling that was above the bands there. So we treated her with MyEllevate. We treated her with energy. And this is her right after. This is less than a week, just a few days later. We can see the wrinkling is gone. There's a little bit of bruising there, and the skin's going to continue to tighten. This is how the words she said immediately after the procedure, which took less than an hour.
So Sandra, you just had a procedure called Elevate. Can you tell us what that was like?
It was easier than a massage. It was pain-free, very comfortable. It was a quick procedure. And here I am walking out just about 20 minutes after, and I feel like I can conquer the world.
Would you recommend it to others?
I certainly would. And I can't wait to see the results.
As we've been saying, that doing it in the office with local anesthesia is really an easy way to do these things with big results. Our next patient that I'm showing you is Lynette. She's 50 years old. You can see she had the banding starting, the loose skin starting, losing some of the neck definition, and also she had some excess eyelid skin as well. This photo on your right is less than a week or about a week after. We see the muscle bands are gone, the skin's starting to tighten, and we're going to hear from Lynette also live tonight. Here's the garment that's put on afterwards. Many patients ask, well, what do I have to wear? What do I look like for the first week? We have this garment. There's a space for your ears. It's all Velcro, easy to put on, and that molds and holds the form of the neck, keeps the swelling down. And it's a good thing to wear. And we'll also ask at night you wear a collar that prevents you from tilting down, because that also ensures that the definition will be brought out and swelling is reduced as much as possible. Here are Lynette's comments the next day.
Go. So the procedure itself was very simple. It was so much easier coming to the office instead of having to go to a full hospital or medical facility. The procedure itself during it was virtually painless. Dr. DiBernardo was very informative while we were going through the procedure, letting me know what to expect and what was going to happen next. Before I knew it, the procedure was done. I was wrapped up. I went home. I was fairly comfortable through the night. And I would absolutely recommend this to anybody who doesn't want to have or doesn't need to have a full neck lift procedure. This is definitely the way to go.
And I think we have Lynette live here tonight. Can you hear us?
I can hear you. Can you hear me?
Yes, welcome to the webinar, Lynette. And there's lots and lots of people on tonight, and they've been watching all about the MyEllevate procedure. They didn't hear about eyes yet, but we will maybe ask you about that also. So I've been talking about the technical aspects, and they heard some, from our plastic surgeons, and we really want to, talk to our patients and get the patient point of view here. So what do you want to tell them about maybe why did you choose this to do rather than the other options that were available to you, and what was it like?
So as you saw some of my photos from the before, I had some concerns about my neck really starting to make me look like I was aging more than I wanted to, mostly because of Zoom calls and FaceTime with family. And so I decided that I wanted to rejuvenate myself with some kind of procedure that was going to make this disappear, all of this, and tightening all of this to just make me feel young. And so this procedure itself was minimally invasive, as you saw from some of the patient videos as well as my video. No general anesthesia, which is amazing. You get it done in the office, so it's very private. If you don't want people to know what you're doing, it's very private there. It's simple. I think I was there maybe an hour from start to finish. I went home, had no discomfort, wore the garment like Dr. DiBernardo says. And, it's a very simple procedure. No one wants to go through a full neck lift with a lot of cutting and suturing. And as you can see from the videos, nobody would know that you had anything done two days later. No one can see anything. So my recommendation is, if you don't want to go through a big surgery, this is the way to go.
And we've been on here for half an hour saying it's easy, it's quick, it's in the office, and that's what it is, right?
Oh, absolutely. I couldn't believe it myself. I mean, Dr. DiBernardo does a great job explaining before the procedure, but he also does an amazing job while you're having the procedure done. So as he's talking it through, the time is going by so quickly and you don't have any discomfort. So when he says, "Oh, okay, you're done," I said, "Oh, okay." We put the garment on, went into the other room, got dressed, and went home.
Is it strange
unbelievably simple.
Is it strange or weird being awake while we do these things? You do have numbing and we give you some pills to relax, but how's that?
It was very comfortable. Again, Dr. DiBernardo usually has some kind of music playing in the OR, which is soothing for myself, maybe not for everyone else, but and the fact that he talks to you during the procedure, and there's usually an assistant there in the room, they're also talking you through it. So the time goes by. If you think about how fast a half an hour goes by, it's unbelievable. And because there's no discomfort, it's unbelievable, really. I was a little bit apprehensive at first because you just feel like, oh, it's my neck. It's, there's not a lot of room there. Is this really going to be painful? And it wasn't. It was very simple. I'm so glad I did it.
One last thing. So we're going to be talking about eyes. You've had your eyes done. You had the excess skin. You want to just tell them how you felt about that and why you chose to do something about your eyes?
Yeah, so again, I turned 50 last year, and the more FaceTime things you're doing, you really start to take a look at yourself. We always say a picture's worth 1,000 words. When you see yourself on live camera and you're looking back at your reflection, my eyes were aging me, and I didn't like the way it looked. I probably hadn't worn eyeshadow for a very long time because it just never really looked right as the skin started to sag. And once again, the procedure itself was so simple. If you post-op instructions are so important. Icing for 24 hours. The only thing that you would have seen that you would have known that I had anything done were the steri strips that go over the few sutures that you have. Again, no discomfort, no problems with vision, nothing. It's unbelievably simple.
And one last one. So I see a lot of patients for their neck. We talk about MyEllevate, and when we're looking, they do have excess skin on their eyes, and the two aesthetically go very well together. Would you, as a patient, recommend doing that both at once?
Oh, absolutely. Because there's, you do have some downtime as far as, vigorous exercise and things like that. So if you're somebody who's active, it makes complete sense to do the procedure at the same time, because again, it's done under local anesthesia in the office, private. Maybe it takes, maybe it'll take you an hour and a half. It's like just about a little longer than your lunch break. And you come out and you just feel unbelievably rejuvenated. I mean, I feel great. I feel like everything looks great. And I couldn't be happier. And thank you to you, Dr. DiBernardo, because it's really your work.
And Lynette, thank you for telling all these people about your experience, and we appreciate it, and have a good night.
Absolutely. Thanks for having me.
Okay, thanks. Okay, moving on. So we found that we were doing the MyEllevate procedure on patients in their 30s, 40s, 50s, and we had tremendous response from patients who were 60 years old and up. Now, the difference with that group is now there's more, still the muscle laxity, but there's more excess skin. And although our energy devices can do pretty well, as I showed you for tightening, when you get to a certain point, it's not enough, or you can do the MyEllevate, it'll look better. But if we add energy or something else, it's gonna look perfect. So that's what we call the hybrid procedure, or MyEllevate Plus. And if you were watching the video, Dr. Travato was alluding to that procedure on Lewis, and what the MyEllevate Plus is, everything we just said, but we go behind the ear and we pull a little of that excess skin from behind. Sometimes we'll pull some of the muscle from behind also, and that really gets the next age group to be able to do this. And here's one of our patients, Betty. She came in, she was all excited about MyEllevate, 73 years old, has all the requirements, but she had more excess skin. So that's why I suggested for her and her situation, MyEllevate Plus. So as you can see here, it's 10 days later. All of that wrinkling, the jowling, the muscle bands are completely gone with that. She does have a small incision in front and behind her ear, as Dr. Travato was saying in the video, but this was done in the office. She took about an hour and 45 minutes to do everything. The difference between her and Lewis, who spoke, Lewis did not have energy. Betty had energy also. So it really got everything again in less than 2 hours. Here's her other view. At 10 days, you see a little bruising in front of her ear, but not a lot given the amount of improvement she had. And as I said before, I don't think if I took her to the hospital for 4 hours, I could have done any better than this with all of our technologies going full force here. So we saw Lewis before on the video. He's 75 years old, and he had, again, he had to really be a MyEllevate Plus procedure, because look at the excess of skin.
I can't believe that I just finished this operation and I'm going home and I have no pain, I have nothing, absolutely nothing. This is perfect. I couldn't ask for. I meet with my friends over the telephone, a Zoom call, and every other week. And yesterday, they knew that I had a cataract operation, and when they saw me, the first thing they said, Lou, you look different. What did you do? You look a lot younger. So, and they have no idea what we did.
So that was 1 week later. So that was like 10 minutes later, and then 1 week later. And we have Louis live with us tonight from the East Coast of Florida. And let's see if we can patch him in. So Louis, they just saw you a few times. Dr. Travato was speaking about you. We showed you speaking 1 day after the procedure, 7 days after the procedure, and now we're way after the procedure. And I explained to them that the MyEllevate Plus procedure has a small excision in the back. And I've told them all the, doctor things, but can you, as a patient who is in that age group, tell them what the experience was like to do a MyEllevate Plus, why you did it, how do you feel after, was it worth it?
Yes, worth it. Unbelievable. It's great. When you feel young, forget about the calendar. If you feel young and you look at after this procedure, you feel great. And that was the main thing. And I didn't like to see that extra skin under my neck. And when I went over and you guys did this for me, I couldn't have a better result. It makes you feel good. It makes you feel younger. And I would do it with my eyes closed again if I had to. It's no pain. It's fast. And you saw me when I came out. It was no pain at all. And
the existence of this procedure, which is kind of new, didn't exist before. If this did not exist, would someone like you have done a facelift or a neck lift or that bigger procedure?
I don't think so. I don't think so. First of all, this procedure makes you look natural. It's something like nothing ever happened before. And that's what I like about it.
Sometimes the less you do, the better you look.
Right.
In surgery.
Right.
So, so for our audience, I guess you're saying you recommend this if they're older and want an improvement, this is the way you would go.
And it's no downtime. That's the main part.
Yeah, you were back in action pretty quick. And as you said, the people that you saw that knew you really couldn't figure out what was done. And soon after, they really were perplexed.
Yeah, they thought I was in a diet or something. It's something changed on you, but we can't figure it out what. And that made me feel great.
Well, that's great. And I love your comments. And we thank you for joining us tonight, especially while you're away down there in Florida. And stay warm. And we'll take care of the snow up here for you.
Thank you.
All right, we'll see you again.
Bye-bye.
So we heard a lot about MyEllevate, MyEllevate Plus, and now to conclude MyEllevate, we can now really treat all aspects of the neck, including the muscle bands. It takes less than an hour, local anesthesia, performed in the office, fairly fast recovery. And again, this is one of our great breakthroughs in the last few years. We've heard from our patients. They've all reiterated that that's what it was. And the MyEllevate procedure was on the cover of Elle magazine in December. And that was listed as the top aesthetic procedure for the year 2020. So that's a big accolade. And we also want to do a strong thank you to Dr. Greg Miller in Beverly Hills, California, who you saw in the video, for developing this procedure. So Greg, thank you very much. And we're going to move on. The last thing I want to talk about tonight is another great breakthrough, thanks to technology, and that's for aging eyes. Just like the neck lift, patients don't want to go through a full hospital procedure for upper lower blepharoplasty, that it's called, for skin sagging over the eyes, skin touching the eyelashes. The temperature is an in-office procedure, local anesthesia, and it doesn't use any scalpels. We remove the skin with energy, and I'm going to show you why that's important, because when we use energy, we actually have less scarring. We did a study with the temperature device, which you see here. It's made by Cynosure in Westford, Massachusetts. And we monitored these patients for 3 months with a lot of high-tech imaging. This, I don't like to show you too many surgical things, but this is taking out the skin. And what's remarkable here is it's a very clean cut. There's really no bleeding, and there's no damage to the surrounding skin. That's why it heals better. Next. The scalpels were how this procedure was done for the last many years. Now we use these little tips that emit energy, and that's how we do the procedure. And this is really the big breakthrough. What we did in our study is we took biopsies of the edge of that wound, and we sent them to our associated facility in our research centers, University of Pittsburgh, and they did scanning electron micrographs, which are these which magnify it 10,000 times. And these are collagen fibers in the skin. On the left, you can see it done with a scalpel, where the scalpel drags and the collagen fibers are all kind of irregular. And on the right is using the temperature, where it's a clean cut. And why this is so important is you have to think of what the body does with these results. When you take that spaghetti, which is on the left, and put it together, there's a lot of spaces, and the body has to heal, so it fills in all the spaces with scar tissue. When we take the temperature ends and put them together like this, there's no work for the body to do. There's really no scar tissue to be produced, and that's why cutting with energy, with temperature, is a larger breakthrough. This is another imaging device we use called the VivaSight, where it sends a laser under the skin, and under that arrow is exactly where the incision was. If we had a scar or scar tissue, you would see a dark black area underneath, but right under the scar, you see nothing. You really don't see much scar tissue at all. So let's look at real before and after, or real after pictures of these. You can see these are upper eyelids 3 months later, and you can kind of see where the incision might be, but it's very well healed. Here's another one. That's why bringing these spaghettis together, the body has very little work to do and less thick scar tissue to add into the wound healing process. Here's another one. Just go through the next two, the next one, and the next one. These are just beautiful scars. And after this study with temperature, we went on to do a study on facelifts. We went to do a study on breast lifts. And when we actually do the MyEllevate Plus procedure in the back of the ear, we use temperature. We still don't use scalpels, and we get that nice healing even with the MyEllevate procedure. Next. So these are just some eyelid patients where you can see hanging skin, touching the eyelashes, and by removing that, it cleans up the whole upper eyelid. Here are more Asian type eyes, and depending on the age, you don't want to take out too much skin, because too much skin removed, this is in a gentleman, can look overly done. And here you can see that heavy eyelid, and getting that out just really changes how people look at your eyelids. And that's, as I said, the first thing they look at on your face makes you look much younger. These are Shirley's eyes, and you're going to hear from Shirley in a second because she's going to help you with all your raffles. And Shirley's been with our team for the last 25 or more years. So, oh, we're not going to give away her age, but you want to say anything about, you were not that old when you had excess skin on your eyes, and how was that for you? Why did you want to do it, and how was it?
Of my son at 5 years old with my eyelids sitting on my lashes then. So he's going to be 20, so it's 15 years. And my eyelids have never looked this young in forever, maybe in my teens. So it was definitely worth it. It was a half an hour local, in and out. I went back to my office and back to my desk.
That's why I wanted to just touch on the eyelids also. Not that we wanted to bring in a new topic tonight, but because when you do your neck, it's very easy to do eyelids at the same time. And I think, as Lynette was saying, when you do these things, you have a little bit of recovery, and it's the same amount whether you do one or two things at the same time. And it's still, with these technologies, we can do all this rather quickly. So my final conclusions are combining MyEllevate and Tempture delivers a, quote, cutting edge breakthrough in facial rejuvenation options for patients with rapid recovery. MyEllevate treats all aspects of the neck, skin, fat, muscle bands, in the office, local anesthesia, and fast recovery. Tempture, aging eyelids can be treated very effectively, minimal bleeding, less tissue disruption, better scars, faster. Combining the two great innovations, and that's why we want to bring those to you tonight. And everybody has stayed on. I thank you for listening to us for so long.